Hi there, this is Mark Ittleman, speech-language pathologist, and welcome to the teaching of talking. These little videos that I'm doing every day are designed to help those caregivers at home understand aphasia and understand some of the mistakes that are frequently made by family members that can cause a great deal of time to be wasted. And one of the things that are very, very important is that we use our time efficiently and expediently so that we can do everything that we can to get the best results in the least amount of time. Now, what I'd like to speak with you about today is something called motor speech disorders. And motor speech disorders typically occur with different kinds of neurological problems. They can occur very easily and readily with a stroke or a brain hemorrhage or any type of brain injury. And so when a person has an injury like this, they can wake up in the hospital one day and all of a sudden they can't talk. Now, there are two occurrences which happen, and these you need to understand. One of them is an aphasia. An aphasia is where the words are lost. They can't seem to construct what they want to say. They can't seem to recall a particular word that they want to use. And that quite often is very, very frightening to the person with aphasia, as well as to the family member. And so when an individual cannot construct a sentence or recall a word, it's because the path to the language center of the brain, and that's the center of the brain that's kind of like the depository of all the words that we know. And there's something called a lexicon, and the lexicon is it's sort of like a dictionary. It has all the words that we know in it, and that's in our brain. And then in that area also is a language formulation area, where not only do we have to recall particular words that we want to use, but we need to be able to construct an utterance, construct a question, or construct an answer to a question. And so if an individual has aphasia, they often lose the ability to pull up the right word and to construct a phrase, a sentence, or a question. So that's the aphasia part. But now there's something else totally different, and this you really need to know also. This is about motor speech. Now you might say to me, Mark, well, what do you mean motor speech? Well, motor speech is the production of words, how clear they are, how well they're said. So if you notice with me, I try to be extremely impeccable with the sounds of words that I use, and I like to speak at a set speed so that no one has any difficulty understanding me. But in a motor speech problem, quite often articulation or the formulation of sounds of speech are affected and they're distorted. Either they're distorted or an individual loses the ability to say words. Now, they know the word they want to use, but they can't get the tongue to work right. They can't get the lips to work right. They can't get the lips and the tongue, or the lips and the teeth, to work right. And that's called an apraxia. An apraxia is when you can't move the structures inside of the mouth voluntarily the way you want to. And that's called an apraxia. And so if you try to get a person with an apraxia to say a word and you're saying, say after me car, or say after me ice cream, or say after me hamburger, and they can't do that, it's quite often because the motor isn't working properly. Now, one of the things is that many therapists don't really know how to work with an apraxia of speech. And quite often, many give up on speech therapy very quickly if there's an apraxia. Because an apraxia is a complex speaking difficulty, and there are some therapists who know how to approach an apraxia. An apraxia is you have to basically go back to the very simplest levels of speaking, and that's called the phonemes. And the phonemes make up the vowels of speech and the consonants of speech. And the vowels, you know, A, E, I, O, U. We have to be able to teach those with apraxia how to produce a vowel again. And the vowel is the easiest speech sound to stimulate. And so we have to go back all the way and teach a person how to say vowels, teach a person how to say consonants. Then we have to teach them how to say pa or ma or sa or la or sha. And it's a very systematic process that many therapists don't really know how to do. That's number one. And the second thing is many don't have the patience for it. And thirdly, sometimes there just isn't the time to address an apraxia. But I can tell you from personal experience that I've worked with many people with apraxia, with severe apraxia, and have taught them how to speak again, but it's a considerable process. So an apraxia is a motor problem. Now, what a lot of therapists are doing today, many therapists are very technologically oriented these days, okay? So if they see that a person with an aphasia or an apraxia has a severe problem, quite often they want to do the most expedient thing, and so they might just recommend one of those talking machines, one of those alternative communication, alternative communication device. And so unfortunately, many people don't really care for alternate communication devices, and many of them are being given these devices, these very expensive devices, too early. The therapists just don't want to address the severity of the speaking problem, and so want to go to the most expedient thing, which would be a talking machine. And a lot of patients just don't like them. And not only that, they're difficult to program, and they're just not natural. And so you want to be careful. You want to be careful to make sure that if you have an apraxia of speech, that you find a therapist. Please make sure that you find a therapist who knows how to address an apraxia, because just because you have an apraxia doesn't mean that you can't learn to speak again. There are many who do, but you got to find a darn good therapist in order to do that. So that's what I wanted to share with you today about apraxia. It's something you need to know, especially if you're dealing with aphasias. Now, there are some aphasias that don't have accompanying apraxia, okay? And if that's it, fine, okay? But many do, and some of the apraxias are severe, some are mild, and you can find out a lot of information from a good therapist who's got the experience. So I wanted to share this with you. This is Mark Idelman, speech-language pathologist. And if you'd like some more information about teaching of talking and how we help people who have speaking difficulties speak better or speak again, you can go to our website at teachingoftalking.com, or you can go beneath this video, and you'll see a couple of links there. One is to the teachingoftalking.com. Click on that, and that'll take you to our website. Right now, it's just about ready to be reignited, and so our new website will be out live very, very shortly. And you want to get on our mailing list. And if, however, you want to speak to me, maybe about a particular speaking difficulty that you may have or somebody in your family, you could go down to the other link below this video, which just shares with you a questionnaire. And what I suggest that you do is fill out the questionnaire and send it to me, and I'll look it over, and we'll see if you're a good fit for the Teaching of Talking 2.0. If that's so, we'll arrange for a call, and we can talk about what the problem is, how to approach it, and things like this, which will set your mind at ease. So, I'd like to thank you for stopping by. This is Mark Idelman, speech-language pathologist. Have a great day, and don't forget to contact us with the links below. Bye-bye now.